Hello friends, let us now learn some important points about peribiliary system. So what is peribiliary system? Peribiliary system. Okay, these are cysts. Definitely they are cysts. These cysts are actually small, around zero point 0.2 to 2.5 centimeters in diameter, and these cysts are small. And where are they located? Peribiliary, around the biliary system. So what is biliary system? It is nothing but porta hepatis. So these peribiliary cysts, peri is around, they are located around the porta hepatis, or they are located at the junction of main right and left hepatic duct. Actually, if you see, a hepatic duct will divide into a right hepatic duct and it divides into a left hepatic duct. Exactly at the junction of this right and left hepatic ducts, here we can see some cysts, which are nothing but peribiliary cysts. So there are two locations of this peribiliary cyst. One around the porta hepatis, second at the junction of at the junction of right and left hepatic ducts. Then, if you see the clinical features, actually the patient is not symptomatic. There are no symptoms, that is, the patient is asymptomatic. No symptoms are present, and only rarely, very rarely, we can suspect the presence of biliary obstruction can be seen. Then, what do you see pathologically? On pathology, we can see these peribiliary cysts are mainly because of some obstructed periductal glands. So around the duct, there are some glands. Whenever these glands are obstructed due to any reason, then these will develop into the peribiliary cysts. So it is mainly due to the obstructed periductal glands. Peri is around the duct and they are glands. The glands will be something like this. If they are obstructed at its neck, so obviously this glands will slowly develop into a cyst. And the main observation is on ultrasonography. On ultrasonography, you see that these peribiliary cysts appear as small, discrete, clustered cysts. They look like either clustered cysts, or they can be some tubular structures can also be seen, and sometimes you can also see the tubular structures are seen with thin septa. Between the tubular structures there can be thin septa can be seen, and they might be seen along with bile ducts and portal vein. So if you see the picture on ultrasonography, you see that these are actually the peribiliary cysts, which are number one discrete, they are clustered cysts, that is, many cysts are seen at one place, they are clustered cysts, and they also appear as tubules. So they are tubular appearing cysts. So if you see, these are tubular appearing cysts, and in between two cysts, you can only notice that there is thin wall is seen between the two cysts. Okay, thin walled, or we can say thin septa are present between the two cysts, and they might be seen parallel to bile ducts and portal veins. So these are the important points about peribiliary cysts, and these pictures are taken from this journal article. Thank you.